50% of adults have some form of gum disease, and most don't even know it. Many patients...
Our nation can only be as strong as our health, and we're not doing well now. We have twice the chronic disease of Europe and 4 times that of Mexico, Japan, China, and India. 75% of our medical costs are caused by chronic disease by things that we can prevent. We know how to prevent 75% of chronic disease right now, but we don't do it. The gap between our knowledge, that technology, and our increase in medical costs grows, and because of that, we're now at a much worse point. Only if America stops the influx of chronic disease, only if each individual stops their own chronic disease, can we lead in healthcare, and can America be a vibrant country with a high standard of living.
To have true healthcare reform and not health financing reform, we really need to help people create health. The reason for the spiraling healthcare cost is not because of irresponsible insurance companies. The healthcare costs are rising because we've got a lot of unhealthy people. To cause a clot and block. I'm currently on the board of directors of the American Academy of Private Physicians. And through this organization, I've been introduced to many innovative technologies, many innovative testings that are going to really impact my patients' lives and implement into what I now consider a third era of medicine practice. The first era of medicine was the beginning of time. That was the era where our main focus as health providers didn't have a lot of tools at that time, was to battle infectious diseases. That's what killed people. So once we had improved public health, once we had antibiotics, once Elvis got his measles immunization in 1958, we transitioned to the second era. It's the era of combating chronic diseases. We started getting terrific heart surgeries, started to be able to identify and treat cancers. And throughout the last 50 years, the amount of technology, medicines, treatment options have been fabulous to, once we find the disease, and fix it. So the mindset of every physician in the country is finding the disease and fixing it. And the third era needs to be a new mindset among all health professions to participate to help our patients create health and have more good years. Within creation of health, we're helping to take a person who is not yet sick, has not developed a problem, and prevent them from ever going down the path to sustaining that illness. So as I'm identifying patients with disease, I would have a subset of patients who I couldn't find a cause for the problem. Well, then when I discovered the amazingly strong association between mouth disease and the things that I do treat, like blood pressure, diabetes, heart attacks and strokes, even things like pneumonia, and a whole long list of systemic diseases that can originate from disease in our mouth, that was another turning point in my career. Once I looked inside the mouth, I found the source of a lot of problems in people who otherwise might not have had their problems identified.